Good afternoon everyone and welcome to the East Midlands Ambulance Service virtual AGM. This is the first virtual production that our communications team have done, so please bear with us if there are any technical difficulties. I'm sure there won't be, but just bear in mind this is the first time we've done a live production. I've got with me today Richard Henderson, our Chief Executive, Will Legg, our Director of Strategy, Pen Anderson, the Deputy Director of Finance, and Nicola Bramall, our Director of Quality Improvement and Patient Safety. And it's a great pleasure for me to be able to share with you some of the highlights and headlines of last year. It was a difficult year, as it always is in the NHS, and it was no different for EMAS, but we were still able to make some significant improvements to patient services. And I'm going to share some of those with you now. The detail you'll be able to find in the annual report and also in our quality account, which is accessible via the website. Firstly, I just wanted to say it was an absolute pleasure to be graded as or rated as a good organisation overall by the CQC and outstanding for caring, something which our clinical staff are justly proud of. The CQC were also were able to tell us that they felt we had workable plans in place to deliver our vision, the big three: respond, develop and collaborate. They felt and believed that we had a strong person-centred culture, and staff told them that morale had improved significantly and that they felt well supported by management, which was great to hear. The next slide, please. Thank you. It was my absolute pleasure to be able to strengthen our clinical leadership team through the appointment of Nicola Bramall as our Director of Quality Improvement and Patient Safety and Dr. Leon Roberts as our Medical Director. And together they have taken with their teams significant steps forward in developing our quality strategy and our improvement processes. During the year, we were able to teach 20,000 young people how to save a life through CPR on Restart a Heart Day. We introduced our dementia-friendly ambulances, firstly in Leicestershire and Northamptonshire, and then at the moment we have over 100 vehicles which are dementia-friendly, designed by a colleague working in Leicestershire and rolled out across the East Midlands. This is an ambulance which helps to make it an easier transport journey for patients suffering with dementia. And I wanted to thank many members of the public that had taken the time and the trouble to knit twiddle muffs, which help dementia patients feel more comfortable and at ease when travelling in a strange vehicle. That initiative has been acknowledged or nominated for a British Medical Journal Award in their Innovation in Quality Improvement category, and we're very proud of that. And while we're talking about awards, it's a great pleasure to be able to acknowledge our fantastic fleet team and frontline colleagues who between them were responsible for the ambulance conversion design, which has been named the best in the UK by NHSI and NHSE, and they should be very proud of that. It's a design which gives the patient a much smoother journey. It's very difficult travelling in the back of an ambulance sometimes. As I said, you can find further details in our quality account, which is on the website. And last but not least, I wanted to say thank you, and I wanted to say thank you to the whole EMAS team. Our staff across all counties, our volunteers, our patient representatives, for pulling together to allow us to provide the best care possible to our patients during the COVID period. This has been a very, very challenging time for everyone concerned. COVID has been a devastating pandemic, and lots of our colleagues have experienced grief and sorrow during this time, and our thanks from the whole of the board go to them and to our volunteers. We're not out of the woods yet though with COVID, and it's still around. We still have to take social distance measures. We still have to follow national guidance, and I want to take this opportunity to remind colleagues in the importance of doing that. We need to use face masks where appropriate, maintain good hand hygiene and social distance wherever necessary and in the community. I'd just like now to hand over to Richard Henderson, Chief Executive, who'll give you a little bit more information. Richard, unmute yourself.
Thank you very much. So good afternoon, everyone. Thank you very much for taking the time to join us today for the AGM. I'm immensely proud to be sat here as the Chief Executive of the Ambulance Service, and echoing Pauline's comments around the thanks and appreciation to the whole of the organisation for what they have done over the past year and continue to do so in this next year ahead. Bit of context of the organisation. So last year we dealt with over 1 million calls, emergency calls and urgent calls, whilst we respond to the population of just under 5 million across the East Midlands. As an organisation, we have over the past year just over 3,500 staff across the trust and multiple roles and disciplines, many involved in frontline patient care, but also quite a lot of staff in other functions, enabling and support services for the trust. Supporting those colleagues, we have in excess of 2,000 volunteers, and I'm pleased to say that those numbers grow. This year, our frontline within the organisation and our employed staff is now in excess of 4,000 people. So a really, great thing to see that the organisation continues to grow in size. In the last year, we recruited an additional 400 staff to the organisation, many of those within clinical roles, and it's fantastic to see such new enthusiasm across the organisation, and those people I know have settled in well. Alongside recruitment, what we've also done is we've changed some of the way that we train our staff. So we're training people in different ways, going into partnerships with new university providers across the organisation, again, which is something new to us, but equally has been very well received. I'd like to just sort of mention a few things around what we've invested in. So we've invested in lots of new ambulances. So having the latest technology and the equipment on the front line. So when we respond to our patients, we have the newest vehicles available to our staff and ultimately for the patients to experience, which is something which is great and we'll continue to do that. And our ambition is to further reduce the age profile of our fleet and make sure that our equipment is truly fit for purpose. We've also invested in some of our estate to make sure that we can not only make sure that the environment for our colleagues at work is fit for purpose, but where we can, we have made further estate changes and will continue to do so. And I'll give a couple of examples in a few moments. When we talk about recruitment, we've also recruited a lot of patient staff to our new patient transport services. So complementing the Derbyshire service, we've welcomed colleagues to the Chesterfield teams and also the Northamptonshire patient transport service. Again, a fantastic opportunity for us to take on new contracts, new services and respond to patients as part of the ambulance service. When we talk about the estate work, we've done a lot around blue light collaboration. So I can think of numerous examples where we've gone into partnership with the police service, the fire service, or indeed in some examples where you have a tri-service where we have police, fire and ambulance all in one environment. An example would be South Park in Lincoln. We've also got examples in Nottinghamshire and Leicestershire, and also in Derbyshire where we had new ventures. And we'll continue to be having conversations with colleagues in Northamptonshire where we can expand our estate and change some of our environments that we operate from. The year 1920 wasn't without its challenges. From an operational perspective, we responded to more patients quicker than we have done previously, and that's something that we'll continue to do so. And I'm pleased to see that we are getting to more patients quicker than we ever have done before. It's not without its challenges, however, not only around the type of demand and the volume of demand that we face. We've had examples of where delays at hospitals have meant that we've not been able to get some of our patients as quickly as we would have liked to have done so. And that's something which we continue to work through with our system partners and hospital partners to make sure that we can remove and reduce those delays as much as possible. What we're also really keen to do is to make sure that we can, whilst we're continuing to train and recruit new colleagues, we want to enhance the offering to our colleagues within the service. So those people already work for East Midlands Ambulance Service, where we can enhance their career opportunities. So frontline colleagues who can develop from their roles, be it in a non-emergency role and moving into more senior positions, or working in a patient-facing role where they can enhance and develop their skills further. And that's something which we continue to do so. And an example would be as we're rolling out the latest specialist practitioner role, which is something which I'm really pleased to see, and I'm really pleased to see that we're progressing further with that. At that point, I'm going to say thank you. Thank you very much for listening. I'm going to hand over to my colleague now, Nicola Bramwell, who's our Director of Quality Improvement and Patient Safety, and I'll take any further questions in a few moments.
Thank you, Richard, and good afternoon, everybody. I'm Nicola Bramhall. I was absolutely delighted to join the EMAS team last July as the Director of Quality Improvement and Patient Safety. And since I joined, I've been working really closely with Dr. Leon Roberts, our new Medical Director, to enhance our clinical and quality services and strategy. One of the things that we started to do last year was we started a programme of engagement with our staff, our stakeholders and our patient representatives to develop our quality improvement strategy. And we started off by doing an exercise asking people what quality meant to them. This is clearly a subject that's really dear to people's hearts because we received numerous responses, and there's just a very small sample of the responses that we received on the screen for you at the moment. We were influenced by both national and local NHS priorities, and the discussions that we had informed the development of our quality improvement vision, our quality improvement objectives and some priorities. And our new strategy, I'm really pleased to say, was very enthusiastically approved by our Trust Board at our September meeting last week. A copy of the full document is available on our website, so please do take a look at that. We've used the Care Quality Commission domains of caring, responsive, effective, well-led and safe. And we've identified clear priorities in each of those categories. And we've been really clear as well in the ambitions as to where we would like to get to in each of those areas over the next 5 years. And we've included in the strategy some examples of the evidence that we will use to demonstrate that we've achieved against those priorities. And we were really keen that the strategy was something that really gave a sense to people of what it would feel like and look like when we're successful, both for patients and for staff. So I just want to take the opportunity to thank everybody who was involved in the development of that strategy. It's absolutely not a plan to sit on a shelf. It's a strategy that will shape the improvements we make over the coming years for the benefits of our patients and our staff. One of the things that we know is that raising concerns and learning from experiences is really important to our staff, and it's also important to us that we have an open, honest reporting and learning culture, because we believe that that's really key to the delivery of safe and compassionate care. And we use staff feedback to directly shape our approach, and an example of this was right at the beginning of the pandemic. We responded to concerns raised by our staff by introducing the use of level 2 personal protective equipment, so that's face masks, gloves and aprons for all 999 urgent PTS responses, whether we knew that the patient was suspected COVID or not. And that's because we found through feedback from staff that they were attending jobs where we didn't think that was the case, and it turned out that there was either the patient or somebody in the household with symptoms. Interestingly, a few days later, that actually became national policy. So we do listen to feedback from our staff, and we have a number of channels that our staff can do that. The slide that you're seeing at the moment just shows some of the areas of feedback that we received from our 2019 staff survey, and these are the areas that we're focusing on in the coming year. Of course, feedback from patients and the public is also really important, and we review feedback that we get from compliments and concerns shared either via our patient voice representative groups or direct contact with our patient experience team, or indeed colleagues from our local health watch groups across the East Midlands. And I'm aware that we have John Crouch, the chair of our Patient Voice Forum, some other patient voice representatives and indeed representatives from Health Watch in the audience today. So I'd just like to say welcome and thank you very much for joining us. Our Trust Board also regularly receives stories from both patients and staff, which helps us to understand their experiences and use those to improve our services. One of the new ways that we've introduced to really support improving our learning and improving culture is by sharing case studies. And these are case studies where things have gone really well as where things could have gone better. So we've introduced new learning from events sessions that are held fortnightly. They're open to all of our staff, our volunteers and staff working for our third-party providers that we use. They're delivered through Microsoft Teams by our clinical and quality teams. Now, as Pauline and Richard alluded to earlier, time isn't on our side today. I could talk all day about some of the things that we've been doing in the last year, but instead I will, like Pauline, encourage you to review our annual report and quality account, and of course you can follow us via our social media accounts on Twitter, Instagram and Facebook if you want to keep in touch with all things EMAS. So thank you for listening. I'll now hand back to Richard and Pauline to introduce the next speaker. Thank you.
Thank you, Nicola. I'd like to introduce now Pen Anderson, our Deputy Director of Finance, who will take you through some of the headlines of the annual report.
Thank you, Chairman. Good afternoon, everyone. Last financial year, we had a turnover of 219 million, a significant increase on the previous year. This was as a result of working with our commissioning colleagues and meant that we were able to invest in additional frontline staff, vehicles and associated costs to help us manage the increase in the activity that we saw. In terms of our capital investment, it's been important to us to invest not only in new vehicles and equipment, but also in parts of our estate too. At the year end, we met all our financial targets, ending the year with a cash balance of 11.2 million and delivered a surplus of 1.4 million against our NHS target of 1.3 million. If you would like to see a copy of our full accounts, they are on the website along with the annual report. Thank you for all of you for taking the time to listen. And I'll hand back to the chairman now.
Thank you, Pen. And our last speaker, but not least, is Will Legg, our Director of Strategy and Transformation. And I'll straight over to you, Will. Have you unmuted yourself, Will?
Look at that. Thank you very much, Pauline, for the reminder. My name is Will Legg. I'm Director of Strategy and Transformation in EMAS. And during 2018, we engaged with a wide range of staff and stakeholders to help us develop our new trust strategy called the Big Three. We also took this opportunity to refine our vision and values, and our vision is to be responding to patient needs in the right way, developing our organisation to become outstanding for patients and staff, and collaborating to improve wider healthcare, hence the term the Big Three of respond, develop and collaborate. During the first part of 2020, we also took the opportunity to refine our strategic objective as we knew that we were entering a challenging time in responding to the COVID-19 pandemic, and we wanted to be completely focused on delivering the best possible care to the public and our patients during the time of need. We recognise that the COVID-19 pandemic had the potential to change everything in the way that we work and everything for the public. To help us understand the changes that have occurred during the response to the COVID-19 pandemic, including what worked well, what we could have improved upon, and so forth, we created the Restoration, Recovery and Reset Group in EMAS. We've worked hard to gather information about how we responded to COVID-19 so that we could build an even better, stronger organisation from the future. I'm really proud to say that over 600 colleagues responded to a short internal survey which we ran to help us determine our next steps and how that work should be continued. Engagement with our staff has been pivotal in developing our future strategy. I'm also proud to say that the findings from the work of the Restoration, Recovery and Reset Group have led to a recent development and approval of a new transformation programme in EMAS, where the key themes will be taken forward over the forthcoming months and years. Staff engagement and feedback is really important to me personally and also to the whole of our board. We often encourage staff to get involved and make things happen, and the pandemic has meant that our usual face-to-face conversation cafe sessions that we've been holding out in the divisions and A&E departments have moved to a more virtual platform now, and we've been utilising Facebook Live to have those conversations with staff. We continue to get good involvement from our colleagues, both during live sessions and in the virtual conversations that follow those sessions afterwards. Thanks very much for listening, and I'll hand you back to Pauline and Richard.
Thank you very much, Will, Pen and Richard and Nicola. We're now going to take some questions from colleagues, from staff, sorry, from people that have attended the AGM. I'm just waiting for them to come up on the screen so that we can see them, and then we'll start to address them. Just for your information as well, a video of today's meeting and the Q&As will be published on our website by the end of the week. Probably the video of the meeting later today, but the Q&As probably by the end of the week. So the first question, thank you. The first question is from, just bear with me, I've got the right glasses on. The first question then is a question for
I'll take that one.
Richard.
Yeah,
and the question is, are there any plans to further grow or supplement the CFR role to greater assist the Trust and our patients?
Okay, so thank you very much. Excellent question. The short answer to that one is yes. We rely very heavily on the use of volunteers within the NHS and indeed within the ambulance service, and I'm really pleased to see that the number of schemes that we have across the East Midlands ambulance service area response continues to grow. So not only are we looking to expand further the numbers of schemes and responders that we have responding in the communities, but also the medical director, Dr. Leon Roberts, is looking around some of the skill sets of some of the response schemes and what we can do to further support some of those responders. We have a wealth of people who bring the expertise from their daily life into the ambulance service, and that's something we'll continue to expand on. And again, we're really proud and very pleased with what everyone does day in and day out. So thank you.
Thank you very much, Richard. We've got a question now for Nicola. Nicola, somebody wants to know what is the best way of proposing new ideas to yourselves for initiatives which could become extremely fruitful and beneficial to all involved. Unmute yourself, Nicola.
Yes, thank you for this question. It's a really, really good question and really fits in with the quality improvement strategy that I've just talked about. We love to hear new ideas and we'll absolutely give those due consideration. There's a number of ways that you can do that. I'm more than happy for people either to email me directly or my deputy Tracy Hamilton, or indeed you can use our patient advice and liaison email address to provide any ideas and we can consider those. So thank you very much for raising that question. It's a really good one.
Nicola, there's a question now, I think, which again we'll ask Richard to respond to, if that's okay, Richard. Yeah, and that is, have we got the resources we need to meet the challenges of winter and the ongoing COVID period?
Thank you. So I think we first of all we need to kind of reflect that as an AGM we're talking about 1920, but I think bringing ourselves into the current environment we're in, we know the NHS is absolutely crucial to our daily lives. We need to be able to make sure that we do everything we possibly can to have enough and appropriate capacity to respond to our patients. From an ambulance service point of view, we've delivered very well during the early days of the COVID period, and I want to take this opportunity to say thank you to everyone involved in that. Day in, day out, people go above and beyond, and we've delivered a very high level of service to many people, so thank you very much. As we go into the next period, what we have to do is to make sure that we absolutely ensure we have sufficient resourcing on the front line. There are lots of additional activities that are taking place behind the scenes to not only make sure that our resourcing, our staffing is fit for purpose and robust, but equally what we can do with other partners. So, for example, the 111 service, how we work closely with other members of the health system, so the local, the acute trusts, the CCGs and others, to make sure that the demand that we face is as low as possible and appropriate as possible, because there are many patients who actually can be treated in more appropriate ways than by the 999 system, but equally what we have to do is to protect the 999 service for those critically ill patients at their time of need. So that's something we'll continue to do. And in answer to the, the immediate answer to the question, as it is at this moment, we have robust plans to do that through the winter period.
Thank you very much, Richard. A question now, I think, for Nicola. Nicola, what other professionals do we have in the organisation?
We have a wide range of professionals working in the organisation. I'm glad that we've had this question, because I think sometimes when people think about the ambulance service, they just think about paramedics, and paramedics are obviously a large part of our workforce, but we're also supplemented by a number of other healthcare professionals. So we have nurses, midwives, mental health nurses, we have pharmacists working in the organisation, doctors, as well as our paramedics, technicians and emergency care assistants. In addition, of course, to all the specialist staff we have working in our enabling and support functions that were mentioned earlier. So patient experience specialists, health and safety specialists, safeguarding, infection prevention and control specialists. And I think the real key to that is that it's really important that we have a really good multi-disciplinary, multi-professional team so that we can provide excellent care. Thank you.
Thank you very much, Nicola. I think that brings us to the end of wait a minute, is there another one? Yeah, I think this brings us to the end of our questions. Does it? Oh no, sorry, there is another one just come in. Do forgive me. It's a comment. You should be all very proud of the work you do and have done. We are blessed to have you looking after us. So on that very positive comment from somebody who's attended, I'd like to draw the meeting to a close. Thank you all for taking the time to join our short virtual AGM, but I think we managed to get our key points across, and thank you very much for the questions that you've posed and for that very positive comment at the end of the meeting. Don't forget that we'll be posting a video of today's meeting on the website, and a copy of the Q&As will also appear probably a little bit later on in the week. So once again, thank you very much for attending. Keep safe and keep well.